In traditional East Asian medicine, the abdominal is the most important evidence-based method to understand herbs, form the disease patterns, and understand when the treatment is complete. A skilled practitioner will be able to have this confidence in the clinic, so they'll be able to not only replicate their formula structures, so from patient to patient, they'll have the confidence when to conclude these formula structures. It will not only give you the herbs, the formula structures, but it will give you the understanding when the treatment is complete. Not only that, it will give you the understanding of the treatment progression, the prognosis. So as the abdominal changes, you can understand the importance of where in the treatment they are at. So it's very easy to resolve signs and symptoms. If you ever have a headache or constipation or period pain, these things are very simple to resolve. They're just symptoms though. You need to understand natural function and how you need to restore natural function. That's why the abdominal is crucial, because when you are checking the abdominal and you're finding responsive discomforts or shapes or pulsations or coldness, these things are very important because it means there's some type of obstruction inhibiting natural function, which means it's inhibiting the movement of gas fluids or bloods. And it's understanding these methods not only to identify herbs, but understand the progression of the treatment and where you are in the treatment. Because if you discontinue the herbs or you modify the herbs, it's something that's very common in modern clinic where people will do these things because they're uncertain of the herbs. The abdominal will change that because it is a way in which to understand which formula is prescribed, and you understand when you begin the formula and when the formula needs to be concluded, because the abdominal structures will change. These things will change, the structures will change, and this is how you understand when a formula is needed to be finished. And probably the best example is Tori Yoshimoto when he treated a young girl, and she had a bowel obstruction, so she had constipation, abdominal pain, no appetite. So this went on for years, and her father brought her to Toto and he prescribed the form of Dachinchi tongue. And then just after a few days, her signs and symptoms started to resolve. So she started to have an appetite, her bowels started to move, but her abdominal did not change. So the herb called Da Huang presents with this responsive discomfort in the upper epigastrium. It has this shape at a higher dose. And he was explaining to the father that treatment wasn't complete, but the father said the signs and symptoms had passed and he didn't want his daughter to continue the herbs because he understood that herbs were toxic back then. And they left, and it was only 3 months later that they returned with the same symptoms, but worse, because this is what happens. If you do not resolve a disease toxin, symptoms get worse. So in the clinic, you might treat somebody and they get better, but they will move on and then they will present with more serious signs and symptoms, because that's how the body presents. If there's an obstruction and natural function is inhibited, the body is trying to tell you a story, and the story gets worse because the body is only trying to tell you that there's an obstruction. And then when this girl returned and Toto prescribed the same form, and then it was after 5 days, she presented with this dirty, putrid, sticky stool. So when you clear that, it means that the body's going through a detoxification reaction. So it is clearing the obstruction. And then when that obstruction is cleared, then natural function restores. And that is when you check the abdominal and the shapes have disappeared. And this is exactly what happened in this case with the girl. And then the treatment was considered complete. It's very important to understand this because signs and symptoms are very easy to resolve, but clearing obstructions, they need to be confirmed so you know when to stop the formula structure. So the benefits are huge. You identify herbs, you identify the dosage, you identify the formula structures within those herbs, you identify the progression of the treatment, and you identify when the formula structure is finished. These are key points that a clinician that are prescribing toxic herbal medicine needs to understand. You do not need to continue formula structures thereafter, because this understanding, this ancient understanding that herbs were toxins, this is very important. They should be discontinued when the treatment plan is complete. There is no need to take herbs once an obstruction is cleared, because you only nourish the body with foods and grains. It's very clear in the ancient medical classics that food and fluids, they're used to nourish the body, and herbs were used to clear obstructions. It is very important that herbs are only used to restore this natural function. And this is why abdominal is very important. And not just using pulse and not just using signs and symptoms, you will miss formula structures. I myself studied pulse for more than 10 years, went everywhere to try and follow the best practitioners in pulse. And I just had this feeling of not wanting to go near the abdominal because I felt like pulse was this magical method of understanding formula structures, but I was wrong. You need to have concrete evidence to identify herbs according to the abdominal, because the pulse can give you ideas of what function is inhibited. You can understand certain things, but it needs to be confirmed. You cannot use your imagination to prescribe toxic herbal medicines, and this is why abdominal is very important.